We are live.
Okay, this is Senate Appropriations, March 31st. We're doing FY27 budget presentations. Today we have Diva. So I'll let you, Commissioner, produce yourself and give us your presentation.
All right, sounds good. Good afternoon, everyone. I am, for the record, I am Deshaun Rose. I have the privilege of serving as the Diva Commissioner. I also have folks online who I would like to introduce or have them introduce as well.
There they are.
Alicia. Allison.
They all seem to be there.
No, now we're
some of them disappeared.
Fabiola.
Okay. Well, when they come back,
That's because they got in front of the butcher committee.
they heard the we are feared. Yeah. Okay. Well, I'm sure they'll. Or I assume so.
Oh, there's one.
Yeah.
Who's falling down? As it get weak, now they get a little tired after a while.
I know.
All right. Alicia, would you care to introduce yourself?
Good afternoon, everyone. My name is Alicia Cooper. I'm the Director of Managed Care Operations for the Department of Vermont Health Access.
And then Allison. Allison, would you like to introduce yourself?
All right, I heard my name when I joined. I was having everything froze for me, so apologies. My name is Allison Novak. I'm the financial director for in the Diva business.
All right, and then Alex will be sharing our presentation today.
Hi, good afternoon. For the record, Alex McCracken, she, her pronouns, Director of Communications for the Department of Vermont Health Access.
Okay. Thanks.
All right.
And you have presentation.
I do have a presentation. All right.
The one listed testimony.
All right. Good afternoon, everyone. Today we'll go over our overview of Diva and then our FY27 budget, both on our admin and on our project management, our program side, as well as one-time funding. And if we have time, considering I know I have 30 minutes, but I'll just run through everything. We'll list key accomplishments as well. When you see things in blue, I just want to note that we've discussed in our BAA testimony, so it'll just serve as a refresher for folks. Next slide. So one of the things that when we came in earlier this year, we talked about how the executive leadership team at the agency, which is comprised of the Secretary, Deputy Secretary, Medicaid, and Health Systems Director, and the 6 commissioners, identified the agency-wide priorities to guide our budget and policy discussions. Those areas included housing, substance use and mental health, healthcare affordability, sustainability, and quality, as well as building a strong and resilient agency workforce. With these priorities in mind, the leadership team developed our budget by looking across the agency as one integrated agency instead of 6 separate departments. We look to identify programs and approaches that we're working and building on them, making difficult decisions to eliminate efforts that no longer met our goals, and targeting investments for policies and programs that most effectively advance affordability, stability, and protection for all of Vermonters. Here we see is the mission of Diva and our values. These have not changed. What has changed, you will note, is we have refreshed our priorities going into this year. And that is, instead of going through the 3 established, which was value-based, performance improvement, and workforce, we changed it to include 5. and really championing member-centric excellence. Viva's mission is to serve Vermonters, and so we strive to put the members first in everything that we do. Thinking about how do we use plain language, making letters and websites easier to read, and how do we incorporate member feedback in our policies and programs moving forward. The second one is to promote a high-quality provider network. We remain focused in growing our provider network in Medicaid. We understand that having coverage isn't enough, and if we want to, we have to have providers at the table. The third is advancing population health and quality of recruitment. We're promoting a more whole health focus, not just focusing on the medical bills of Vermonters. This ensures that we're looking at access to preventative care, such as screenings and checkups, and considering things like food, housing, and transportation to improve their health. The two last remaining priorities are really internal for Viva. They are to strengthen our operational infrastructure and system modernization. And it's important for us to think about how we operate behind the scenes and have good processing, such as processing applications, payments to providers, managing our systems. And then lastly, we can't do this without our folks, our workforce. So this is our last priority, supporting our staff through training, building leadership, and making Viva a place where they want to work and stay. Next slide is Viva has a unique role, serving as both a managed care plan and core functions of a Medicaid agency. We, under law, we determine the eligibility, overseeing compliance of federal and state requirements, setting provider rates, managing benefits. At the same time, we operate as a health plan responsible for paying claims, managing our provider networks, advancing value-based models, monitoring quality. This kind of dual identity allows us to directly align policy, financing, and care delivery in ways that other states cannot. Now, turning to our FY27 budget in summary, our budget total for this upcoming year is $1.3 billion, $579 million in general fund. Here you see it broken out. About 10% of that is from our admin side of $198.2 million, of which 56.96 million comes from the general fund, and programmatically makes up the large percentage of 1.156 billion of 522 from the general fund. So diving into our admin budget, and for those who are following along in our budget book, this is on page 47. The numbers that you see reflected here in the PowerPoint represents the total across all of the sections and the components that are broken out in the spreadsheet and our ups and downs. I just also wanted to make note that the agency was managing a $75 million shortfall, which shaped every aspect of this budget. We have not proposed new initiatives beyond what is required by federal or state law. We're recommending several reductions moving forward. Here,
can you describe how you're doing this gross? Is this the net in the gross or the general fund in the gross? I'm not following what you mean by those terms.
Yeah, so this is our gross amount. So this is the total from, if you look at our ups and downs in our spreadsheet, we have several sections. Right. And so we're aggregating all those sections into this one PowerPoint.
But the gross is a lower number.
So the gross, yes, so the gross is of the general fund plus federal matching that we would receive on the Medicaid side.
But when you're taking like the general fund and subtracting the federal money to get the gross, because the gross is a lower number than.
Oh, for that may be I apologize. I see what you're saying there. Underneath the salaries.
The salaries of retirement, the gross is a lower.
Yeah,
number.
I think that I'll have to go back and make sure that I'm pretty sure that one that is a typo. I just don't know. Okay, we'll fix that and report back to you on that.
And like all the childcare FMLI, that's like a negative 30K gross for the 130K general fund.
Correct.
So I just don't understand how the gross is a lower number on any of the sweetness.
Yeah.
Maybe it could be up and down.
Allison, do you have any insight on that?
I'm looking at the ups downs right now, and I do see the salary. I think that might just be a typo, but it is also how we're merging all the benefits together. So it does, I do see about the 30K gross and the 130K GF. So I'll just have to look to see how that roll up is because it's a multitude of different accounts. Okay.
Go ahead.
And then from our vacancy savings, this represents what our budgeting at above 3%, but we are also seeing a 5% vacancy rate right now, which we're currently recruiting to fill in those vacancies.
And these negative numbers are compared to last fiscal year.
Correct. Moving on in terms of contracts, as the secretary mentioned earlier in her overview of the agency budget, we were making difficult decisions to eliminate efforts that no longer met our goals. One of those was the Medicare advocacy program. And so the purpose of this contract is to assist the state in recouping Medicare funds for dual eligibles. However, over the years, we have consistently paid more for that contract than we have recouped. For instance, in 24, we had an ROI of 60%. In 25, we saw only 50% ROI. And so while we did have this, so as one of the things that we were looking at in terms of efficiencies, we felt that this was something that we could no longer afford to move forward.
What is VLA?
Vermont Legal Aid. The second thing you'll see under our contract is the Chief Medical Officer Support Contracts. These are two contracts that we contract for mental health clinical needs as well as for helping with our increased prior authorizations. And so you see that as a 27,000 general fund, 54,000 gross. There are a number of IT systems. So our our Medicaid management information system, which is updates and maintenance, which requires us to do some is an amendment for prior authorizations and interoperability development that stems from federal requirements, which that aim is to increase data sharing across and reduce overall payer and healthcare provider administration burden. That request is 150,000 general fund, 1.14 of gross. The second one is our contract with Maximus for our call center as well. And then the last one is the health HEDIS, which stands for Healthcare Effectiveness Data and Information Set, which is quality measures that we use for quality reporting across both federal and state purposes. We found an inefficiency there using the Medicaid data warehouse and the analytics solution can now provide that functionality. And so we no longer needed that contract. Moving on to our DIVA and on our ADS and operating expenses. Here you will see the data warehouse annualization of maintenance and efforts of 2.12 million, general fund total of 8.49 gross. We also needed to increase the cost of our Oracle licenses for clinical, and that is of 140,000 general fund. And then we also have our general maintenance for our MMIS system, which is 67,000 in general fund. In terms of operating expenses, again, you've seen this, we've discussed this in our BAA testimony. We are renting new space in Pilgrim Park, and that new lease space comes at 159,000 of the general fund. There are two big things, other things that are in our admin budget. HR 1 is really driving significant changes in our Medicaid eligibility. That will be implemented for January 1st. That includes changes to healthcare eligibility based on immigration status, more frequent determinations every 6 months for new adults, and community engagement requirements for that new adult population. We are estimating a total of 12 new positions that will be needed in the eligibility unit to meet those requirements. The positions will be reassigned from the position pool, and we're also requesting just over $1 million or $510,000 in general fund for the estimated 9 months of the position costs, plus equipment needs there.
Was that included, those positions in house budget?
Yes. There's also changes that impact our operating costs in terms of that will have to be more noticing to be printed, and that is an expected cost of $290,000, which is the shared $72,000 in the general fund. The other thing that to be noted in our admin budget is the school-based services will move to DIVA effective 10/1. The Medicaid school-based services will be administered by DIVA. AOE will retain the responsibility for the educational policy of this. We are recommending a new position in our business office. We also will have new school-based electronic health record and random moment time systems that will be implemented on 10/1, and those startup costs for both are being covered by the Federal Home and Community Services branch funding, and this system will require some ongoing maintenance beyond what is available in that funding.
So with the transition from AOE over to DIVA, what resources will be brought over to DIVA to compensate?
So we'll have that new school-based position in the business office that will help with the
But
payments.
will that come from AOE? They must currently have some management position, administrative position. So are they eliminating a position and we're shifting it over, or is this what's happening?
I think it's an entirely new position. I see.
I'm phoning a friend.
For the record, Noel Langle, the Joint Fiscal Office, this is the administration's proposal.
Got it,
Know that the House made some changes to this.
got it.
So
I haven't seen it yet. So.
Yeah, so somebody can come in and talk a little more specific about how they changed that proposal a little bit, including the positions, there's some swap.
Okay, thank you.
Yeah.
And then the payments to the school districts, which is $17 million from special fund. That includes on the admin side. In terms of our DIVA program budget, there are baseline changes. Here you see the consistent caseload. This is something that we deal with every year. And so what we're seeing as the factor of the HR1 plays a significant role in our caseload calculation this year, specifically for that new adult and general adult eligibility groups. But we also, while we're expecting that decrease in caseload, we're also seeing a general spend in general adult to increase that needed to be reflected in our PMPM. And so while we see that drop in enrollment, that higher PM cost was driving that higher increase in our caseload or in our utilization. The buy-in is allows states for the Medicare dollars to buy in for the dually eligible beneficiaries for Medicare. These might go otherwise forgo Medicare utilization due to cost. So we pick up their cost sharing. The number of month buy-in costs are determined at the federal level and then tied to Medicare financing calculations. The other one is the Medicare clawback this year. So every year Medicare claws back funding for prescription drugs. This is to reduce state costs. However, states reimburse the federal government. So this is just reflecting that we're reimbursing the federal government's costs associated with the transfer of prescription drug coverage. We generally like to try to absorb those costs, but this year we could not. The fourth item here is the annualization of the Medicaid savings fund expansion. These amounts are presented as the estimated annualization for that 7 months of that expansion up to 150% of the federal poverty level. And then every year, we talked about that, we discussed this in DAA. The federally qualified health centers and rural health centers are required a rate change. And so this just reflects that increase of 2.7 adjustment in for 2027. In our next, here we'll see several policy changes. This is a part of our agency executive leadership team. We came together to solve a $75 million shortfall. So hard decisions were made. One, you'll see this is a rate increase. This is the only rate increase besides the QHC and RAC. And this is for the Northeastern Family Institute Hospital Diversion Program. The rate increase proposal is targeted towards that specific youth diversion program, which is had a required rate review. This increase is as a result in that.
Senator Lyons, did you have a question?
Well, I was gonna get to when you get to the planning rate.
The family planning rate?
Yeah.
You want me to talk about it now?
Well, as soon as you get there.
Then we have the applied behavioral health analysis code. This is where we transitioned some, we instituted a policy in our ADA in which we no longer allow concurrent billing for 2 codes that were inherently included for supervision. And so here you see that change there. And this is support to kind of come into compliance and reduce our risk as a state. The family planning rate, Senator Lyons, is that we were not able to implement the appropriated family planning increase consistent with the legislative intent. And that's why we recommended removing that in our VA. And so this is just a continuation of that in our proposed budget.
So I've heard that it has been implemented down here and it's not.
It has not been.
90-10 match.
Not under there was 85,000 of the general fund that was appropriated last year that required us to do that enhanced match. We could not implement that in the way that that legislation required us to do. And so that's the reason why we couldn't implement it.
So if we can't implement the way the legislation required it, is there a way that we can fix the legislation so that you can do it?
Yes, so the answer to that is yes, and we've been working with Planned Parenthood on that, what that would look like on our end. So
okay, well, when we meet, we can talk about it.
Yep.
Okay.
Yeah, we'd want to know what that change is if we need to do it.
The third is the per diem for emergency department stays. We recommend discontinuing the per diem rate for mental health extended stays in the emergency department, effective beginning of the next, 27. This rate was initially implemented in July 2022 as a temporary fix in response to a crisis. The utilization has since declined significantly. And we have run this by our clinical utilization review board, which has also recommended discontinuing due to the minimum uptake.
You're discontinuing entirely, or you're lowering the per diem?
We're just entirely. We're getting rid of this payment. The next one is the dental incentive program or payment. This is eliminating dental incentive payments to providers. The payments were intended to encourage private dental practices to accept Medicaid patients. However, because of these modest payments, we have not seen a measurable increase in access there.
Okay, so what would be an example of a provider that would get this? This was for them to encourage them to offer dental services?
Yes, yes. The next one you see is an increase in our prescription copays. We are recommending an increase in copays from $1 for, let me get this right, so messed up my numbers, from $1 to $4 for preferred drugs and from $3 to $8 for non-preferred drugs. We have not updated our cost sharing since 2001.
Yes.
So going to $8 seems pretty significant. for the people we're talking about with, who are zero income or low income. So with, I just registering that as a concern, and I'll continue to do that. I'm not sure how any of these folks are going to be able to pay for their prescription drugs.
Yeah, I understand that and see where you're coming from. These were hard decisions that we made at the executive team level. So, but.
What analysis did you do in terms of the effect on the Medicaid patients that we have?
On what their out-of-pockets would be, or?
Yeah.
I mean, so they would still have that out-of-pocket cap, that 5% cap is still in place. So if they reach that because of the prescription drugs, they wouldn't have to pay anything more than that.
5% would still be a lot for these people.
Let's hope the Vermont prescription drug card goes through, or something changes here. And then it will be important to look at what's happening around us.
Yes,
Yeah.
well, also certain vulnerable groups, such as children and pregnant women, are exempt from the cost sharing as well.
Still people.
I mean, correct, I understand that. The next is 900 is the utilization and management. The Depot Cleanup team has engaged in some initiatives related to the efficiency and system alignment, consistent with clinical best practices in areas such as DME, special rate agreements, coding reviews. And so we estimate that because of that, we could save about $2.2 million in growth. The last one is a reduction in our base due to the ACO ending. That used to be, the ACO uses in LPMPMs to about $4.75 for primary care, and that because we no longer have a mechanism to send that payment out, this is the reason why we have put in that reduction.
Can I go back up to, so at some point I'd like to chat with you about utilization management and how you're accomplishing that.
Yep, we can have that.
Okay.
Would love to have that conversation with you. And then for one-time funding, we have two recommended requests here. One is for require system changes. The budget to implement the HR1 is about $5 million. We have grant funding of about $2 million from federal funds, and so we expect the main cost to be matched at the 90%. And then lastly, we are requesting $2 million for provider stabilization to support the stabilization of our providers in achieving sustainability within the system.
These were in the governor's direct and in the House budget?
Yes. And with that, I have some key accomplishments. One, we have worked really hard, the team has worked really hard to kind of sustain the marketplace. We've implemented the $10 million in provider stabilization that the legislature appropriated to us. We have awarded to, or in the process of awarding to providers. And so we've come out on the last slide, there was a report that linked to the report on provider stabilization on the work that we're doing there. We ended the ACO and we moved forward with hospital global budget, and we expanded the market, the Medicare shared savings program. So with that, wraps up my presentation.
Thank you. If you could just look at that, I think maybe it was only on the first slide where you had the gross numbers that were
I'll look
small.
at Wilson and correct it.
Thank you. Any questions for the commissioner? Any last comments?
Nope.
Thank you all. Thank you. I appreciate it. And assume I do not see.
They're in the hallway,
They're in the
Yeah.
hallway?
Yep.
Okay.
in numbers,
I got the entire Department of Labor.
pretty much.
Do more labor.
Intimidation. I got a cough. 2 or 3 people. I'm separate.
Oh, yeah, yeah. Sometimes that happens.
Remember, he,
What is
these
that?
two guys
It
work
says
together.
5-minute chair massages and cookies in the State House cafeteria today from 4 to 5:30.
They'll be very happy that you announced that online.
Oh, yeah.
I don't know if you're.
I don't know why it's there for the
Right here,
witnesses,
but,
It's for the whole committee. They had wanted to invite the committee, so. Okay.
Yeah, we
just
got
for
a
the
floor
committee.
announcement about
Yeah,
it.
for everybody.
Yeah, just-
I got one of those on my desk.
I didn't get it. Well, I guess they just left it down there. Hello, Chris, good to see you. Okay, we're back, right, live and all that. We're doing our FY 27 budget requests, last of the day, the Department of Labor. So welcome, Commissioner.
Thank you.
And I'll let you introduce yourself and any team members you have and give us your presentation.
Great, and I just wanted to time check 30 minutes is kind of what we're shooting for here.
That's the goal, yeah.
So Kendall Smith, Commissioner of Vermont Department of Labor, and I'm joined at the table by,
Chad Wozniak, I'm the CFO for the Department of Labor.
and then we also have in the room, depending where questions go, Rowan and Chris, you can introduce yourselves.
I'm Rowan Hawthorne, I'm Policy and Legislative Affairs Director at the Department of Labor.
And Chris Winters, Deputy Commissioner of the Department of Labor.
Awesome.
So good afternoon, just looking, we have a PowerPoint, but we will try to stay in the container of 30 minutes that Rowan's putting on the screen, and I believe will be sent to the committee assistant if it's not already for posting or for, further review.
Is it the one that's called spending authority, or do you have a presentation this one?
This is separate presentation. What you might have in front of you is the more kind of spreadsheet looking document, and ours is a little bit different because our accounting system, FARS, is different than Vision. So I know it looks sometimes a little bit,
better?
no. And so I know sometimes it looks a little bit different maybe than other agencies and departments based on our, on FARS, which we'll talk about here in a second.
Okay.
So I believe everybody in this committee is fairly familiar with the Department of Labor, generally speaking, so I'll fly through just the first two slides, which are background. But just as a refresher, I'll start with just facilities and footprint and then get into programs. We have a central office here in Montpelier next to the high school down the street, and that is really programmatic administration, and where approximately half of our employees report out of. And then we have 11 regional offices throughout the state. You'll see the locations on the right-hand side. Those are workforce offices, and what can happen there is people can walk in or they can make appointments in person or virtually for help with job, employment, training, and career kind of counseling type services. So if you want to walk in and say, help me with my resume, or I'm looking for a job, or I need to practice my interview skills. We also have employer liaisons out of those offices that are working with the local communities on the employer side of the house to understand when they have openings and what they're looking for so we can best match the job seekers that we counsel. All right, we'll go to the next slide. This is just a little bit of the primary org chart, and we'll go through the divisions here as it relates to the budget in more detail. We have the commissioner, we have the commissioner's office. You met a few of those folks that are in the room today. And then we have 4 divisions, workforce development, labor market information or LMI, unemployment insurance, workers' comp and safety. Under workers' comp and safety is OSHA, Project WorkSafe, workers' compensation, as well as Tramway. We inspect all the ski lifts in the state, which is kind of a, I guess, maybe lesser known aspect of what the Department of Labor does. Then we also have a legal office, as well as a business office, which Chad heads up. Attached to us in statute, although they are independent in terms of their authorities and what they do, but for kind of administrative support and services, is the Office of Workforce Strategy and Development, which is a newly created office that the legislature put in place about 2 years ago now, that's headed up by Sabina Haskell. They are not here today. We will cover their budget for them. It's pretty straightforward, but depending on any questions you have there, we'll do our best that we might refer you to speak directly with Sabina since they are independent in case we misconstrue anything. There's also 4 boards. You'll see in the corner that are statutorily connected to us, that we oversee the Passenger Tramway Board, again, connected with ski lifts, the Apprenticeship Advisory Board, the Labor Relations Board Nominating Committee, and the Employment Security Board, which is a UI appeals level that you can go through. Go to the next slide. So I just covered, again, our main scope of jurisdiction and work. So I won't necessarily read through that again. We have 263 MFA positions, permanent and limited service. Our current vacancy rate is 12.55%, or 33 positions spread across the divisions, and you can see how that breaks out as we go through. How does that compare to past? Sorry?
How does that compare to past years, or like since you've been there?
This is mostly regular churn. I will say this is a little bit higher than what we even presented in the House because we have some openings in UI, and because we are 18 months away from launching a whole new UI IT system. We're holding off on making a couple hires because it's not going to make sense to train people in the old system for a month when that training is even longer than that, and then retrain them in the new system this spring, summer. So this is even a little bit higher than what we presented in the House, and primarily for that reason.
Okay.
But otherwise, it's mostly regular churn. We are this year, right now, as we sit here, about 50% federally funded. That is actually down a little bit from when we were in last year because we had a major federal grant called the Routine Grant that totaled over 22 million-ish approximately, that is ending. It was a 6-year grant. So that number, if you were thinking about our presentation last year, would have been a little bit higher. Again, as we sit here, we are reliant about 50% on federal funds. And you can see how that's broken out in the pie chart on the screen. In terms of where are the big flashes in the pans here that we want to highlight for you, this is one of them. We'll go through what we know and what we don't as we continue to talk, but we currently do not have our current federal fiscal year allocations.
No.
So we do know the U.S. Department.
26.
Correct. So we're about halfway to 2/3 of the way through our fiscal year of October through September, and we do not yet have our final allocations.
You don't have the money, or you don't have the number for both?
We're currently operating off of the continuing resolution.
Yeah, a little bit of both. So we have access to dollars, but we don't know the full amount of what those dollars are. So we've been operating our programs under the continuing resolution numbers, And we don't know yet what the real numbers are going to be. They haven't divvied up the pie, so to speak, from when the budget was signed in June, at the end of January.
We do have some perspective though, because we do know what the massive USD law budget is and where there's downs. So while I can't promise anything, I'll talk about that a little bit more. I'm not in a panic situation where there are downs because some of these downs are about $10 million of program overall. So that divided by 50 states and territories may not end up being so bad and something that we can work with. But we'll get to go through this again this October. So that's where we're getting a little bit, what's the reconciliation when we sit before you next year going to look like if we don't get our final allocations until like July, August. Chad's been reaching out to the regional office weekly and sharing me some of the very direct emails about how this is very hard for us to plan and
there's nothing they can do.
and our legislative sessions progressing and they're like, we know and appreciate your patience. So, all right.
Okay. Good luck.
Thank you. And look, we can go through a little bit more about where to look out. This is really just kind of a calendar year 2025 mostly service year in review. In the event anyone's interested in, I just went through some programs, but how many Vermonters are we actually interacting with, at least in calendar year 2025. I won't read every one of these numbers. You all can kind of peruse them, and if you see something that interests you, obviously let me know. But interact with over 25,000 UI claimants in terms of self-service through workforce development, 10,500 Vermonters, case managed. So again, a higher level of service is the top 3 bullets that you'll see by kind of cohort, depending on our federal funding streams. So just thought that might be of interest.
Yeah, so Nora?
Unpaid tips, how do you track that?
So wage and hour, is that where you're looking right now? Unpaid
Yeah.
tips, yep. So this is mostly complaint based. So if you feel like you worked overtime and you were not paid, or you are owed tips, or any number of these things, my employer is not giving me the sick time that I've accrued and I'm guaranteed by law, et cetera, et cetera. We have a wage and hour legal team that goes in and investigates those. And sometimes there are findings, sometimes there are not, depending on the investigations. And Rowan, I believe this is the number, because I know you helped put together these, which is why I'm looking at you, of complaints that we received that we did investigate.
That's my understanding as well, yes. There may be more complaints as well, but the investigation, there's a couple different types. There's the full investigation, and then there's just reaching out to the employer saying, hey, there may be a misunderstanding, is this something that you can fix? And then that's very frequently how that is actually fixed. So my apologies.
They can do it anonymous.
You can, but we can't do as much to help you if you figure out how to contact us anonymously. There's less.
Well, just that you don't have to tell the employer who it was that complained. That's
Correct,
what I mean.
correct.
They're anonymous
Again,
to the
yeah.
employer, not to you. Okay, you said everybody.
Are there, ask this, are there fines involved, or is it just corrective action?
No, there can be fines,
Okay.
depending on what we find.
Yeah, and were there any of these that like were different from past years? Because I don't have context of like.
I would need to get back to you on the trend line if you wanted us to compare that year over year. I can say we answered a similar question for House General maybe back in January, and when we looked at it at that time, we weren't seeing big swings. It
was only once you get to COVID, then everything's crazy.
Yeah, if you take COVID out of the trend, yeah, COVID's going to, especially for the Department of Labor, spike all of our programs in terms of activity.
Right. Okay.
Yeah.
Yeah, if you happen to have it, it'd be interesting.
Okay. All right, so now we're gonna get into our budget a little bit more granularly by division, and if, again, anytime you guys want to say like move it along, just let us know. So the workforce development division is what you can see here first. They have approximately 75 staff, currently 9 positions vacant, but several of those are posted and under recruitment. Again, we have those 11 regional offices across the state, so I characterize the majority of that as regular churn. The work that our workforce team does in terms of core services is primarily federally funded. So this is one area that I'm very anxious to understand what our final allocations are. So all of those regional offices, when we are case managing people, All of that is primarily through what's called WIOA funding, or the Workforce Innovation and Opportunity Act, more commonly said as WIOA, and there has been several proposals taken up federally around potentially changing that and changing the construct of it to a block grant, where maybe there'd be more flexibility in terms of how you use funds, but also overall less funding. How the House and the Senate initially were contemplating changing that program differed significantly. Also significantly how from the Trump administration was proposing. At the end of the day, there are not significant changes in WIOA in terms of what the US DOL budget currently looks like, but I'm not confident that that will be the case always as this conversation continues over the next 2 or 3 years. So under here on the slide, you can see discrete amounts of money. These are all program line items that we get federally funded to serve these different populations. And then under that, you can
On the next
see,
slide, I think, right?
no, so federally funded programs,
Oh,
it's all youth employment services, dislocated workers, refugee immigrants, registered apprenticeship vets, and then a program called reemployment services and eligibility assessment, or RESEA. We say all the letters, we don't make it into a word on that acronym. But that is a federally required function where there's an algorithm for UI recipients. And if you are identified as potentially being at risk of maxing out your benefits, you get mandated to participate in employment counseling. And you have to do these counseling sessions with an RESEA service provider in order to continue to receive your UI benefits.
So is that federally funded service provider?
Yes.
Yeah, okay.
And then the state-funded workforce initiatives that we
Oh,
have
it's right there.
are underneath. Yep, sorry, yeah, it's all federally funded, are underneath. So work-based learning, adult CTE, a workforce expansion pilot. We do a lot of sector work, job fairs, and Vermont Job Link is our case management system.
And is the general fund like the same as last year, what, 3% kind of increase?
Yeah.
Yes, better arms.
I see you have refugee and immigrant services in there.
Mhm.
The way the trends are going today, expect to see any additional funding for that particular line item, or?
I do not want to forecast Congress, but no would be my gut reaction in terms of additional funding. We shall see.
Okay.
Our next slide. So again, this is in terms of what we know and what we don't around our federal fiscal year 26 funding levels for all of these activities. So in terms of what's in the US DOL budget that was signed, sorry, I should have adjusted this top line when we did this in the House. We were still working off a conference report that had not been fully passed. But there's no changes in terms of the numbers underneath. The WIOA adult line item is down $10 million. So that again is money when somebody, if anybody in this room was to walk into one of our regional job centers and say, I'm looking for employment and here are my barriers and here's the type of support I need. If you're eligible for WIOA funding, there are some socioeconomic indicators and factors you have to meet. That is what that staff will bill their time to when they help you. So that program across everything in the US DOL budget is down 10 million. I am not necessarily super nationally concerned. So this 10 million down is somehow going to get eaten up by 50 states and territories. A lot of the stuff is all formulaic, and we basically get like a small state minimum.
We get a small state minimum, and to put that into context, that $10 million down is 1% of the entire WIOA budget for the
Yeah.
So this may not be, at the end of the day, something that I'm coming back to when we get our final allocation super concerned about, but I do think important to illuminate. National activities underneath that is a hodgepodge of programs, but ones that you can kind of wrap your minds around is our seasonal farm work program that we help administer through H2A. We have, we inspect housing if you are hosting H2A farm workers, and we also have advocates that go out and meet with those farm workers and make sure that they don't have complaints, that they're comfortable. So this is kind of like in a variety of potpourri of things, but that is probably the most significant for Vermont. That RCA program I just talked about is up 79 million. I think that trends with, again, this administration and Congress's goals of moving people off of benefits, where again, if you're going through RSEA, the goal is that you are successfully moving off of UI benefits and finding more employment. So we will likely get an increase in funding for that activity, TBD, how much. We talked about how it's formulaic, and again, all of these things are national, so hopefully they will not be too significant for us. Where money is also raining down federally to states in certain ways is for registered apprenticeship. All these things you see listed under here are monies that are not going to labor departments, but the federal government has made competitive grant programs for businesses and intermediaries to receive directly if they are hiring and utilizing registered apprentices or starting registered apprenticeship programs. So that is actually great. Apprenticeship is a shared priority for us, for the department, something that the state, and we've worked really successfully with the legislature on in the past in terms of expanding registered apprenticeships and promoting that pathway to employment. So we are promoting these opportunities to Vermont employers that they could be taking advantage of these. The first one, just as an example, is a tax credit that manufacturing companies can apply for. It's pretty significant, and I apologize, I do not remember the exact amount unless you do from all the times we've said this, per manufacturing apprentice or Chris that they bring on, but it's a couple $1,000s per registered apprentice that they hire. And we expect this to continue. So I wrote more to come. We keep hearing that signal there's going to be more apprenticeship money available. Okay. So
I just do one quick question, Commissioner. Under the select industries, do we have a lot of those in Vermont, or last third line down there?
For performance.
I'm sorry, where are you?
The last.
145
Next to the
million
last bullet.
for select
For
industries.
select industries, sorry. So yes, we do have some of those in Vermont. However, they do seem to have a focus on shipbuilding, which we do not do in Vermont in a lot of these, but AI seems to be a focus as well in terms of what can be done around apprenticeship and AI, manufacturing, trades. But the ones that we do see popping up as being priority points when people apply for things like
What about airships? What about electric airships?
Electric
airships.
Electric airships, sorry. No, but I mean, I personally would support that, if they were to create a program that could support that industry. All right, so the other thing, I'm getting through kind of like the heaviest stuff first, and then it goes a little bit maybe more quickly from here. The other thing that's notable about our budget, in case you have questions, is there were several one-time funds that were reverted to the general fund when the governor proposed his budget, outlined here. And I'm happy to walk through those. And there are, just again, being a newer commissioner and there are new staff kind of working through the chain of events, and some of these very much predate a lot of members in this room time. So the returnship program, some of you in this room might remember that. It was from calendar year 2018, and it was funding to support people that had been out of the workforce for a long time, returning to the workforce where they might need to upskill or brush off their training. So think a mother who took time off to stay home with her kids for 10 years and then is returning to the labor force after 10 years of being a stay-at-home mom, and if she needed any additional training or
Was it just like
upskilling.
$75,000 original?
It was 75,000.
Right there.
Where do I see this here? So, no, it was,
Pretty small.
I'm sorry, so it was 37 plus 33. 75, is that what you're getting at? Yes.
Yeah.
So the department spent $33,000. We did not spend approximately $38,000. I know in the context of our budget, this is like decimal dust, but that was reverted. There was a pot of money from, again, calendar year 2019 that we had, $70,000 for post-secondary and new Americans. Act 80 was the budget number that year, and we looked and we looked and we could not find the policy language when we were trying to figure out what is this to go with it. So unfortunately, I will just be totally transparent and accountable. I do not have a good answer for you about what this money was intended for and why it did not get out from the department. We could not find, we found the budget, we found the money in the budget, we could not find any language from all the like the most likely committees and bills.
Sounds like some JFO wanna research.
Yeah, well, again, so 70,000, up to you how far down that rabbit hole you wanna go. The next three, I understand again, are a little bit new year, so $275,000 was appropriated to the department also, in Act 80, which was the budget of 2019, to support apprenticeship training, post-secondary CTE, through workforce education and training funds. We have a lot of other money that we use currently to do this work, and this unfortunately did not get expended, and we relied on additional funds, and I'm gonna point out one of those a little bit here in a second, but we do have a whole separate apprenticeship program line item that's nearly $1 million, just like to juxtapose, the apprenticeship could have been used here, but we also have another $1 million, and so we leveraged other funds.
Okay.
The New American Labor Force money, this was actually a pass-through to the State Workforce Development Board at the time from the department. I do have some historical knowledge of this from my prior role, where they put out a bid for a contractor to help try to identify holes in terms of employment supports for New Americans and create programming and resources. They did not get any bids on the RFP. And then the State Workforce Development Board turned over, the executive director turned over, the new office was created. So that got reverted. And then this last one is the biggest one where I understand that you have the most questions. This was about $1 million for work-based learning programs and initiatives. At the same time, we received an additional allocation of $1.5 million to support work-based learning initiatives, and we did fully expend that bucket and had not gotten to now the next $1 million tranche that was allocated separately. So that was also swept.
Okay.
So all of this money was re-socialized for other priorities in the governor's proposed budget. As you know, that becomes a giant pool, so there's no strings I can draw, but we're very supportive of multiple things in that budget that will support workforce, like housing or resources. All right, next slide. Labor market information, LMI, if you've ever heard Matt Barowitz speak, for example, he's the director of that department. He's one of our state economists. He is very engaging and great at what he does. So they currently have 11 positions. They have one vacancy. This person just left to be a supervisor at AOT like 2 weeks ago. So we're very happy for him in terms of his own career progression. And we will be getting that vacancy posted here soon. This division is also primarily federally funded, similar to workforce that you just saw in terms of their base activities. There is a grant, one of many grants that they received from the federal government called the Workforce Information Grant. And that one is down again nationally, 9.7 million. Same story, not sure how that'll be socialized across the 50 states.
And these ones, these other divisions, it'd be good if we had like the last year's comparison when there's general funds.
We have that on the spreadsheet.
Yes, in a sense, we have that, and we'll get to that.
Okay.
All right, we'll keep going. Workers' compensation and safety. Again, this encompasses 4 different programs at the end of the day: workers' comp, Project WorkSafe, passenger tramway, and VOSHA. Then each one of those is funded differently, where workers' compensation is almost all special funded, or entirely special funded. And then VOSHA is 50% state, 50% federal, and we match and we overmatch. Correct, Chad?
Slightly overmatch.
We're slightly overmatch. What's our match there? It's not a normal 90-10.
For WorkSafe, it is about 18 and 22.
1822.
Yes.
And same for VOSHA?
VOSHA is a 50-50, and then we slightly overmatch more than 50%.
Okay. In terms of federal impact here, there's again a 13 million reduction to US DOL enforcement agencies, including OSHA. But that is other things too, so we are waiting to hear how that ultimately impacts OSHA. But again, we're continue, same story, different division, be hopeful that this will not be dramatic for us and we can absorb any of these downs.
Okay.
Then our last biggie here, unemployment insurance. About 81 staff, 15% vacancy rate. That again, going back to the beginning, and we'll talk about, we want to know around the status of the UI modernization project, launching a new system imminently, and we're thinking it doesn't make sense to bring people on and again, train them for a month in the old system before the new system comes online. But UI, we get all of our administrative funding for UI from federal dollars. So all of our staff salary, again, Chad, jump in if I indirectly, but all of our staff salary for this is all those federal admin dollars. And we're waiting for our final fiscal year allocations. UI admin, again, in the US DOL budget itself was level funded, which in this environment I think is a win, but we will see how that trickles down. We normally receive about 10 million. And so we're hoping that we again receive that 10 million, and I'm not sitting in front of you in a few months saying we only got 8 million, and we now have to figure out how to make up that $2 million hole for the staff salaries essentially in admin work.
And just one small clarification, we do receive some general funds for the UI program, and that's for our modernization efforts, our staff efforts on the modernization.
Okay. That's what that 5 million is?
Is this the area you were talking about, you're not filling vacancies because of the modernizations?
Yes.
You were at 6 positions and you're now at 12.
Yeah, we get a lot of churn, so there's multiple different programs here. So I think our UI call center, high burnout rate, answering the phones all day, taking those claims. Then there's also fraud mitigation, program integrity. You can see kind of the list of their other activities here. And so some regular churn, but again, we will fill these. Our plan is to fill them. It's just, let's wait another couple of weeks before we post them, because again, bringing someone on to train them in the new system and they'll be like, forget everything we just taught you for 4 weeks isn't going to be a good use of their time or ours. All right. The business office, we can honestly kind of over this slide, Chad, unless there's anything you want to add here, but they're funded by socialized contributions across all the programs in the department.
Okay, yeah.
All right. Do you want to know about our single audit?
Unless there's some crazy finding.
Nope.
I'll trust you.
No, I don't know if you want to give like just a 2-second summary,
No,
but
I think
okay.
that's fine.
Everyone's talked about it.
All right. So then, the last thing you should have, this is small, and you may have it as another spreadsheet as well, starts to get into where you wanted to know what was last year's budget compared to this year's budget. So again, I'm not even gonna, I know you guys probably can't read those numbers right now either. So you're asking about our general fund, that is socialized, that 3% increase just across all programs where we can put it, with the exception of SLAs and internal service fees. Those are going up, so the governor's office and finance and management, I believe gave everybody, not to speak on behalf of my colleagues, a little bit more in their ISFs and SLA lines. But otherwise, that 3% is kind of equally spread across all of our general funded activities. Thank you. And for that, remember the other place that's up more than 3%, again, is that Office of Workforce Strategy and Development. Is a new office. Since we were here last year, there was 1 person when we were in last year. There's now 2, and there were 2 positions authorized for that office. Those 2 individuals' salary and benefits are much higher than their predecessors, so they actually had a deficit, and it was a very small budget to start, 200 and something. Do you remember the number?
Okay.
Right, so it's 200 and something. So there is an up to fill. I think it was a $51,000 deficit there, based off their operating expenses.
Yeah, and even though we can go through those and figure out what they were last year, it's difficult. So it'd be nice if you're gonna do these tables, if you had FY 26, you know, the prior year and then this year.
On next sheet, if this is sheet.
Even on the next
Keep
sheet.
going. Okay, so I don't know
It's on the,
if you, so we will get this to you if it's not in your current packet in front of you. But yes, this has the last year as passed compared to this year.
second page has fiscal year
You
26.
mean slide 15, so you mean
Yeah,
that?
I have two books right now.
Yeah, I know you can see it there,
Yeah, I can see it there.
but you have to total it up. Like, you don't just see the number.
Oh, okay.
So we can do that. So you're asking for each division's total for F?
Yeah, like you had these little tables in each thing, so if you had that, but for FY 26, it's a lot easier to just do a quick comparison.
That's an easy, we can do that.
So that is really the end of the dollars and cents story. The other things that we can share with you, depending on what you're interested in or not interested in, is UI modernization. Deputy Commissioner Winters has really been diving in this time here with UI team. That is our single biggest priority this session, is to make sure that new system launches well. It is slated to to launch spring, summer of 26. We're not saying an exact date yet, but we do have one in the contract. We've been very strong with our vendor. It's important to us when this launches, we're confident in it and it goes well.
What's the name of the system?
That's a great question that we've been noodling on.
Okay.
The new UI system.
Yeah. What's the vendor?
Fast is our vendor, and we call the project itself Fuse.
Okay.
In terms of the project name, but in
Come
terms
up
of
with a clever name later.
yes, in terms of like now it's the new UI system. Our current UI system, this might sound familiar to you all, it's about 55 years old. It uses COBOL, and I'm not exaggerating when I say there's very few people that know how to program it, and you really can't do much with it at this point.
This has been a problem for you.
Yes.
So you just start, but this has been going on for a few years.
Yeah, this phase started in calendar year 24.
This phase, so the
This
prior
whole
phase.
rehaul.
When did you sign the contract with that?
We started 24, so there was.
So there's preliminary work for that. And you're saying what, 27?
Nope, it's gonna launch imminently in 2 to 3 months.
Okay.
But why we're not publicly announcing a date yet, and we will invite all of you to any sort of maybe ceremonial ribbon, I don't know, but we'll make sure it works first. Event before we spike the football here is we've been very strong with our vendor that this needs to work well. And so if we need more time, if we need 2 more weeks to test or 2 more weeks to train our employees, we're gonna take that and make sure that this launches as smoothly as possible. There will eventually be an announcement about the dates, but I'm just not prepared to say that.
Has it been on budget?
It has been on budget so far in terms of the money that you all appropriated to build it and to implement it. We are now in the phase where we are considering those out year base costs of licensing fees, and kind of with the vendor, what are they on the hook for moving forward or not when we need updates.
What was the total cost?
Hold on, unless you have that at your fingertips. In terms of the implementation cost, it was 30.
I remember I think we put money
34.
aside a couple of years in preparation for it.
Or Chris, if you have it at your fingertips, and it bring our ABCIT.
Is there an old mainframe that you can push off the top of your building? We could.
I can tell you, our staff, again, this is gonna
More
be.
people would come to the river cutting if they
Yeah,
could see that.
maybe we could like sell tickets or something for a chance to like whack it like a pinata.
Right.
This is gonna be really important for our staff morale as well as for Vermonters and the claimants, and hopefully for you all, where when we're sitting here next year, you'll be able to say the amount of constituent outreach I've received with people struggling with their UI claims has significantly decreased. That is what success looks like to me.
Well, it's so bad during COVID, anything has seemed better.
Yes.
The amount of calls we got.
Yes, so we're currently on time. Budget for that. Again, that is imminent, it's like 60 to 90 days away.
Right.
So more to come there. And when we came into the start of the session, I was telling everybody, this is our single biggest priority, and unfortunately it overlaps with your session in terms of the real crunch time. And in terms of why you may not be seeing us in here every day as we're focused on that project. Otherwise, again, we had very little that we have been proactively advocating for this session. We've been trying to support the education transformation conversations as we can, specifically around CTE and adult CTE in terms of where does labor and education overlap on a Venn diagram. We do have some registered apprenticeship technical corrections that will be moving their way through the process. And then, I know you just had Diva in here, so dare I say it, but we've been working a lot with our counterparts at AHS to prepare for the work requirements that will kick in this winter, and how our regional offices can be supporting people if they need to find employment in order to continue to receive their benefits. So that's been a body of work unto itself that is going on behind the scenes in the backdrop of everything else.
Yeah.
HIT is gonna be so, and IT generally, so important.
It is.
How are you gonna do it?
I know, and again, we've been very lucky with the addition of Deputy Commissioner Winters coming from AHS and some of these spaces to help us really bring these two puzzle pieces together from labor and the Agency of Human Services to.
Because they're getting 12 new staff, but you're not getting any new staff to deal with that.
No.
Do you have any last words about the early college program and how you see that as workforce development?
Yes, I do. So thank you for bringing that up. Just to backtrack, so there is, I believe you're referring to the McClure Promise program.
And then there's just been more discussion about early college. Some people want to get rid of it.
Okay.
So.
Okay.
But they don't know some of
that
the.
too. So.
What do you have any thoughts about?
Yes, so from the Department of Labor perspective, whether it is early college or like I mentioned, the McClure Promise program where you can get your associate's degree after doing early college, we are fully bought into those remaining options for Vermonters and for our students, especially when we look at our matriculation rate into higher education and training being less than 50% right now. And we're trying to get a better handle on where are the other youth going. And if you break that down by gender, it's even less. We're only 30% of our males are matriculating into higher education and training at this moment after they graduate high school. We need to have more ways to keep students engaged in their futures. So whether that's early college, whether that's pre-apprenticeship, whether that is making that associate's degree accessible and accelerated through things like the McClure Promise. I know they have 2 more years of philanthropic dollars going into that. When we think about our workforce expansion goals, and we know every sector right now has a crisis where it doesn't matter if I'm visiting a manufacturer or a farm or a food processor or a hospital, everybody's telling me I can't find workers and I will train. Just give me somebody that shows up every day and can make eye contact. That's my bar right now, and then I will train them. So we're constantly thinking about how are we retaining more youth in our state. Again, there's not a lot of them. Out of our public school system, we're only graduating something like 5,000, maybe 400 kids a year total. And so if you then back down and say, okay, only 2,500-ish, I'm using our numbers, are going to higher ed and training. We want to make sure that we're equipping everybody for their future and to be successful in our communities and in our labor force and in all the sectors. And so, I also think about how Act 77 and flexible pathways comes into play here. I think this is the moment, if we are bought into flexible pathways and we mean that, then we got to mean that. And you have to have these options like early college or pre-apprenticeships or internships or work-based learning opportunities, all of them for our youth, and not be so focused only on what's happening in the 4 walls of our public schools.
Yeah.
Sorry, I know that, I'm sorry.
Good.
Well,
I thought you
thanks
might
for
have an
so
opinion
much.
about it, that's why.
For a second.
And pathways fits in with that as well, because you can kids can just find a directed pathway to something that maybe it's not college. I mean,
Right.
maybe, you know, so.
Is there
I'm totally with
early college version for CTEs? Like if somebody says like either can't get into CTE,
there is
some kind of apprenticeship.
There is, I believe it's called Fast Forward, but I would need to double check that. I'm not confusing that with an ad program. There is, and there has been, this is where I'm getting a little bit over my skis, so I just want to acknowledge that, and you would need to dive in a little bit deeper with the Agency of Education. But I know there has been some kind of questioning about how well is that program working, both for the students and for the CTE centers themselves, both from a funding perspective and, when they see the CTE kids for their second year, their senior year, go off to early college, it makes it harder then to offer those programs in the second year in the school because they're losing the bodies, but I don't think that's a reason to not offer those other opportunities.
Right.
We just have to
It's
figure, we just
important
have
for
to
those that
be,
are taking it, usually are taking it,
Yeah.
because they don't have other options.
right, we just have to think bigger about how then to make the system work.
Okay, thank you. Yes, I don't know.
Just a quick question, so, in case I missed it, where are you, the governors recommend, below percentage wise?
What came to you is exactly what's in the governor's recommend for labor. If that's so,
You
what
were under
brings,
the 3%.
so under 3, we were 3%.
No, with the SLA ups that the commissioner mentioned, and with the ups from the Office of State Workforce Board, we're up at about 4.78% over last year's general fund budget.
It does, however, mirror what is in your budget that came from the House is exactly for labor what was in the governor's recommend.
Thank you. Okay. Any last questions? Any last comments?
Thank you.
Yeah, thank